Dr. Nasser, can you please tell us about your role in the World Federation for Mental Health and what aspirations you hope we can achieve given this year's theme and campaign of World Mental Health Day, mental health in an unequal world? Can you please start by telling us a little bit about yourself and what we hope we can achieve by this year's campaign?
Thank you very much. Yes, well, I've been involved with the Federation for a number of years now, close to a decade. And of all the various societies and associations that deal with mental health around the world, the Federation is the one closest to my heart. It's one that looks at mental health rather than psychiatry, which is something I believe in very strongly, and one that has some very powerful representations of advocacy groups and multidisciplinary professions, but most of all, service users and carers. So it does make it an all-rounded association. I'm privileged to have been elected as president for the Federation. I should start my term in the coming weeks. And, you're absolutely right. This year's theme for World Mental Health Day is really spot on, because the Federation has always, since its inception in 1948, concerned itself with the rights of people to get quality mental health care, to the rights of people to get support and to advocate for their place in society. This year, the world has been through very unusual times. Basically, the pandemic has brought out some very realistic facts about healthcare in general, globally, and mental health care in general, globally. And the theme being mental health in an unequal world looks at the inequality of the care received by various societies around the world. I therefore would highlight that it's the care received and not only the care given, because in a number of societies, mental health care would be offered, but there are other factors that prevent individuals from receiving good quality care. You, of many people, Ali, would know that the stigma that's attached to approaching mental health support has prevented many people in many societies around us to receive the right care. So the inequality that we're looking at is not just at the care provided, but it's at the care accessed and used fruitfully by various individuals in that society.
Thank you. Definitely, Yani, really, it is a responsibility this year that we do provide that access on a larger scale. Now, how do you think the role of youth can help create the change we need in today's discussion around mental health? What do you believe is that responsibility that youth carry today?
I like not to refer to that sector of the population as youth. Youth are the future, and I refer to them as the future. The young people are a much better investment for advocating principles and rights. You're bringing out a whole young generation that would have years and years of impact around the world. So yes, the young ones among us carry this role more importantly than many others. You're right. You're also fortunate in your generation of young people to have amazing access to information and to media. You know, Ali, back in 2006 or 2007, I was leading a mental health campaign in Egypt about the human rights of mental patients. In those days, the internet, the social media, and the connectivity was not what it is now. And I can tell you that it's such a huge cost and a huge effort to produce those videos and to buy airtime on television. Ramadan, I remember it was at Cairo. To reach the public was a huge effort and expense. Your generation is very fortunate that you can do this at the click of a button. And so you will be heard a lot more than previous generations. And that's why we rely on you.
Thank you. Definitely, we are doing our best, and What message would you like to share with our audience today in the Eastern Mediterranean region on our current state of mental health, and where can we start taking action today and making it a top priority as we navigate our way through and out of COVID-19?
That's a very good question, because COVID-19 has taught us a lot about how to live with ourselves and how to accept others. And I think the Eastern Mediterranean region has had a long history of tolerance and accepting people with mental illness. The last century or so was different. You know, we were going through many political changes, you know, colonialism, occupied, West, different cultures, and attitudes towards mental illness suffered, I think, during that time. If there's one short message today I would like to give to our community, is that this person with mental illness could be my brother or my son, or it could be me. So referring to them as them and us is unrealistic. I could at any time develop any form of mental illness. And I would just like to think that I would be treated with respect and with dignity.
Thank you, Dr. Nasser. I really appreciate it. Thank you.